What's up, beautiful people? Another day, another study. We've talked previously about heat therapies, traditional saunas, and infrared saunas. And this is something that I do quite frequently. We have a portable infrared sauna at the house. I try to do 20 minutes at 170 degrees Fahrenheit, 3 to 4 times a week, usually after my hardest workouts to aid with recovery. And then also for my chronic back pain. Those are the two main reasons that I use it. This study was really interesting. So, we see in the literature when you're looking at a randomized controlled trial, you're really looking at efficacy. You're looking at the ceiling. What's the max a therapy can do for a certain condition? But we know that's often different than what we see in the real world, which is effectiveness. So, the real world has different parameters. People do different things than when they're constantly monitored in a clinical trial. And you can even see this recently with like GLPs. What we're seeing in the real world doesn't quite match up as far as the amount of weight loss in clinical trials for a lot of people. So this study was not looking at a standardized, we're going to try to get everybody's core temperature to a certain level and see the differences, but I was looking at different protocols that mimic how people use water immersion, traditional Finnish sauna, and far infrared sauna, and they were looking at differences in body temperature, cardiac output, and immune responses. The exact protocols they used are down below. So they had 20 healthy volunteers, and they had over a period of 3 weeks each person do each intervention, and then they measured the differences between them. Overall, the change in core body temperature and body temperature were highest in the hot water immersion group. All groups experienced an increase in heart rate, with the hot water immersion showing the largest. There's also a greater decrease in mean arterial pressure, which is something that is derived from your systolic and diastolic blood pressure. It's an average. And then there was a greater increase in cardiac output. When they looked at immune responses, IL-6, which is associated with the anti-inflammatory effect of exercise, was highest in the hot water immersion group. They remained the same in the other two groups. The hot water immersion group also saw some changes in the ratio of specific immune cells. And when they looked at how taxing was it, they called this perceptual analysis. Patients in the hot water immersion group felt like it was hotter, more uncomfortable, more physically taxing. And the reason that hot water immersion may facilitate better heat transfer is the high thermal conductivity of water. So it's quicker and more efficient heat transfer. There's reducibility of cooling because of a lack of evaporation through sweating. And then water's hydrostatic pressure may aid in venous return, which is getting blood back to the heart, and that increases cardiac output. There are several limitations. Like we said, core body temperature was not matched. They didn't match in discomfort level. This was an acute response, not chronic. It was small sample size. It didn't look at clinical outcomes. It was more looking at mechanisms. And then if you look at the temperatures, the infrared sauna temperature, the actual mean temperature was pretty low. It was 113 degrees Fahrenheit. Same thing with the sauna temperature. It was low. It was 150 degrees Fahrenheit. These are young, healthy volunteers. So I think that one of the things, and they mentioned this in the study, was that if you're using like an infrared sauna, having the panels closer to you is probably better to facilitate that heat transfer. Anyway, I'll continue to use a infrared sauna in the house. It's the easiest of the three for me to use. And currently, having a newborn and running businesses and all of that, I will continue to look out for more data on this subject because I find it fascinating.